The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Thanks for, crud. We're going to pause that.
Yeah. Obi-Wan Knobbe. You can say that if you want. It helps people remember it.
It does help. Welcome, folks. Thanks for joining us on Predictive Health Clinic. I am joined today by Dr. Chris Knobbe. Yes, just like Obi-Wan. Chris, I'm glad you're here. This is something that is of particular interest to me. So let's talk about it. What particular health issue are you going to address on today's show?
I want to address chronic disease in all its forms and its relationship to vegetable oil, specifically to industrial seed oils. And by chronic disease, Jack, that, for those who are not aware, that means overweight. Obesity is now considered a chronic disease, but it also includes coronary heart disease, stroke, cancers, diabetes, metabolic syndrome, Alzheimer's disease, dementia, age-related macular degeneration, and
Whoa. Say that last one slowly.
Age-related macular degeneration.
Which means?
That is, so the acronym for that is AMD, and is the most common degenerative disease of the macula, which is the central retina of the eye, the part that accounts for our central vision. And AMD is the leading cause of irreversible vision loss and blindness in people over the age of 50 worldwide.
Okay, that's kind of a big one.
Yes, it's
All right.
huge.
Didn't mean to interrupt you. All right, so chronic
Yes.
disease, you're listing chronic diseases.
Yes.
Do we
And
pretty
all
much
of those chronic diseases I have linked to vegetable oils in a causative way. So I believe, based on 13 years of work in this field and 9 years of full-time nutrition research, that the evidence shows beyond a shadow of a doubt that it is the highly polyunsaturated vegetable oils, or what we might call the industrial seed oils, that are the primary drivers of obesity and most of this chronic disease.
For somebody who is new to this, I think we should probably expand on what you just described. Seed oils. What exactly does that mean?
So the industrial seed oils they're a category of vegetable oils that are very dangerous. So the seed oils are really, let me just name them. Those are
Sure.
soybean, corn, canola, cottonseed, grapeseed, sunflower, safflower, rice bran, sesame, and peanut oil. So these are the list of oils that are high in omega-6 fat. And these are the oils that have taken over as the added fat to our food over the last 145 years. So I want to just mention that historically, the world did not have any vegetable oils. Probably 95 to 99% of the world did not have any vegetable oils before 1865. And so then cottonseed oil was introduced in the United States as a food right after the American Civil War, so about 1866. And then soybean oil.
Now, just because I'm curious, cottonseed oil, is it exactly what it sounds like? It's oil made from the seed that grows cotton?
Yes, that's exactly what it is. So it was a waste product. It was a waste. Now, seed oils were like cottonseed oil was being made as early as, I think, around the 1820s in the United States, but it wasn't used for food. It was known as only as machine oil and lamp oil primarily, and then fertilizer. And so Americans did not want seed oils in their food supply, or they didn't want to eat seed oils. And so the industrialists that were producing cottonseed oil, they began to put it into butter and what made what they called oleomargarine, which eventually became margarine. And then the next thing they did, Jack, was they began to adulterate olive oil with cottonseed oil. And then they made Crisco, which is basically the primary source of trans fat in the diet. So they introduced Crisco in 1909 or 1911, I'm sorry. And then after that, so after soybean oil was introduced to the food supply in 1909, then we got all the others. So corn, canola, already had cottonseed. So rapeseed, grapeseed, sunflower, safflower, peanut, and rice bran oil. So those are what most of us call the seed oils. And the seed oils are very high in omega-6 fat. And this is how they drive, this is what makes them so dangerous and how they drive a chronic disease epidemic.
I'm going to ask questions that are kind of off script. You
Sure.
just described virtually everything that we were told we were supposed to be using in our food for the last 40 years. We've been told that these oils are better for us because low fat, because they have a higher smoke point. Therefore, we're not going to get the contaminants that come from oils getting burned. And it sounds to me like you're saying that's bad information.
Yes, yes, exactly. So you're absolutely correct. The mainstream nutrition entities in the United States, for example, Harvard School of Public Health, Mayo Clinic, Cleveland Clinic, I believe, American Heart Association, so on, they all endorse seed oils as being, quote, heart healthy. And the reason that they do, there's only one reason that they suggest that these are, quote, heart healthy, is because they lower our cholesterol. Guess what? So does arsenic. And they both lower our cholesterol for the same reason, because they're highly pro-oxidative. So arsenic kills people, kills mammals, kills any organism through its toxicity because it's a heavy metal. And the heavy metals drive oxidation. This is exactly what vegetable oils do. And by the way, all of our chronic obesity and chronic disease have all risen really in proportion to the amount of seed oils we've consumed in our diet. And not precisely in correlation to sugar or to carbohydrates or even to processed carbohydrates. And I can get into that detail. But for example, in the 19th century, we had no coronary heart disease. It was extraordinarily rare. There was a few cases in the world that were documented. The first documented heart attack in the United States was 1912, and then 1930s, coronary heart disease became the leading cause of death. It was similar for most other things, like cancer only took one in 188 lives in the year 1811 in the United States. It took 1 in 17 lives in 1900. It's almost 1 in 3 today. Age-related macular degeneration, AMD, virtually unknown in the 19th century. There was less than 50 cases in all the world's literature between 1851 and 1930. Today, or as of 2020, 196 million people. Obesity has risen from 1.2% in men age 18 to 80 in the late 19th century to 42.5% by 2018. Diabetes has risen from affecting 1 in 36,000 people in the year 1890 in the United States to affecting 1 in 8 people by 2000. So we went from 0.0028% in 1890 to 13% by 2016, and 51% of Americans are either diabetic or pre-diabetic, and 93% are not metabolically healthy as of 2018, I believe it is. So again, and seed oils rose from 0 in 1865 to 1 gram a day in 1900 to 9 grams a day in 1909 to 19 grams a day in 1960 to 80 grams per person per day by 2010. 80 grams of oil is 720 calories. That's 32% of US caloric intake. Now, there's a little bit of plate losses in there, but I can say with assurance that we're consuming about 1/4 to 1/3 of our diet in America is coming from seed oils, which did not exist before 1865.
There's a lot of devil's advocate I want to play with some of your statistics. I could argue that we have better diagnostics than we had 100 and 150 years ago. But the one thing I cannot argue with, because we can all see it with our own eyes, is obesity. It is blindingly obvious, not to try to create a pun there, but
Yeah,
it's blindingly obvious over the last 40 years that obesity in America has exploded, it's skyrocketed.
right.
I've said many times in my high school graduating class, there were two kids who you could call even chubby.
Hmm.
And it was 250. It wasn't a huge high school, 250 people, but that two out of 250 is less than 1%.
Yeah.
And I would bet that in the standard high school class, graduating high school class today, that number is probably well north of 30 or 40%. Uh,
Hmm.
I can see that. So that's all right. So you claim you've got clinical, I guess, as close to clinical proof as possible.
Hmm.
It is seed oils that's causing this. I'm going off script, but I want to hear more.
When you examine a hypothesis, the most important thing to do is to consider all competing hypotheses. And, for example, when there's a murder, the investigators, if they do a good job, they evaluate every person who could have potentially committed the crime, right? They don't just consider one person, right? This is where they always go wrong when they consider one person, the spouse, for example.
Yeah.
They need to consider every possible person there is that could have committed the crime. And this is what you need to do in nutrition research, is consider every possible, competing hypothesis. So I've looked at, vegetable oils, sugar, carbohydrates, refined carbohydrates, herbicides, pesticides, glyphosate, GMOs, um, the list goes on. And none of these correlate with obesity, diabetes, coronary heart disease, cancer, Alzheimer's, and age-related macular degeneration. None of them correlate with the prevalence of these diseases except vegetable oils. So you can see that vegetable oils rise in parallel to most of these diseases. Now, that doesn't mean that it's a one-to-one relationship, but the relationship is very strong. So I could go into a little further detail if you want me to. I can give
Yeah,
a
well,
couple of examples.
I'll probably point people to some of the interviews you've done elsewhere, but yeah, give us some examples.
Okay, here's one. I'm going to look at a graph I have here that I wanted to mention. Now, sugar has been increasing for hundreds of years, but between 1822 and 1999, sugar increased 17-fold, but the huge bulk of that increase was before 1922. And so, as I mentioned, vegetable oils have been climbing since 1866, right? And so let me give you an example. So I picked out a very specific time period that's 65 years in our history, just to compare, and I'm only going to have time here to give you two data sets. Sugar and vegetable oils versus obesity and diabetes, okay? Between 1922 and 1987, this is a 65-year period in our history. So sugar was already at 473 calories per person per day in 1922.
Good Lord.
This is, I won't say anything that's not published evidence. 473 calories by 1922. We've published this. Stefan Guillenet has published this. It's both published in scientific journals. All right, 473 calories in 1922. That increased slightly to 497 calories by 1987. Vegetable oils were at 78 calories in 1922, increased to 550 calories by 1987. So sugars increased 5% in this 65-year period. Vegetable oils increased 605%. What happened to obesity? Increased from 2.95% in 1922 to 18.6% in 1987. So obesity increased 532% or 6.3-fold. So again, sugar went up 5%, vegetables increased 605%. Obesity increased 532%. Now, let me give you the data on diabetes during this exact same period, Diabetes was 0.09% in 1922, increased to 2.6% by 1987. That's a 29-fold increase, 2,800%. So for sugar theorists, I will say, how do you explain this? Sugar didn't even change, basically. It's up 5%. It's negligible. It's almost a flat, it's a flat curve during that period for sugar, while vegetable oils are skyrocketing. It's the same situation. Carbohydrates didn't change in the 20th century. In fact, they went down between 1909 and 2010. Carbohydrate consumption went down from 499 grams to 477 grams per person per day available. All right. Processed carbohydrates between 1977 and 2017 only went up 8%. That's refined grains. There's very little change in in sugar and carbohydrates and refined carbohydrates, even during these periods where we see this huge increase in obesity, diabetes, cancers, and so on.
But seed oil is the thing that it's a very similar rise in the usage of the seed oil and the incidence of these chronic diseases.
Yes.
Okay, normally I'd say what's the biggest popular misconception and the truth about the issue, but I think you've laid it out that the truth is that there's extremely high correlation between the increased use of seed oils and the increase in chronic disease. All right, what's the likely outcome if people don't take action to do something about this on an individual basis?
On a what?
On an individual basis.
Yes. So what happens with seed oils is that the omega-6 fat, linoleic acid primarily, accumulates in our body fat and accumulates in proportion to the amount that we consume in our diet. And there's data that proves that beyond a shadow of a doubt. Stephan Guyenet has published that. So it accumulates in our body fat, in our cell membranes, in our inner mitochondrial membranes, and it sets up a biological milieu that is pro-oxidative, pro-inflammatory, toxic, and nutrient deficient. So the pro-oxidative is basically like we're rusting inside. Pro-inflammatory is accepted all around the world. Everyone knows that the downstream products of omega-6 linoleic acid are inflammatory prostaglandins, eicosanoids, and thromboxanes that drive an inflammatory environment. The seed oils are toxic through advanced lipid oxidation end products like 4-hydroxynonenal, malondialdehyde, carboxyethylpyrrole, acrolein, 9 and 13-hode, and hundreds of others that we only have chemical names for. But these advanced lipid oxidation end products, they collectively are cytotoxic, genotoxic, mutagenic, carcinogenic, atherogenic, thrombogenic, obesogenic, and diabetic-genic. So they're driving all of the chronic diseases. And finally, the seed oils, all the vegetable oils, even the good ones, the healthy ones like coconut oil and palm kernel oil and authentic olive oil, none of them have any vitamins A, D, or K2. So they're nutrient deficient. And that's a huge deal. That drives degenerative disease. So you put those four together, pro-oxidative, pro-inflammatory, toxic, and nutrient deficient, and you've got the recipe for disaster. You've got the recipe for overweight, obesity, diabetes, cancer, all of this, all driven in parallel to this increasing seed oils. Seed oils are poison. They're fundamentally chronic metabolic biological poisons. They're poisons, plain and simple, and we should never be consuming these.
Never. That's fairly explicit and fairly stark. Okay, and that answers the next question, which is what is the specific action people should take?
Yes, the action is very simple. Eliminate seed oils from your diet. It's not nearly as hard as people think it is if you prepare your own foods or you're just cautious. So you can still eat out, but realize that all processed foods, almost all of them, are made with seed oil. So if you consume packaged, boxed, prepared, canned foods, those things are almost always going to have seed oils, not butter, lard, or beef tallow, right? And then restaurant foods and fast foods, they're all made with seed oils. This is what makes fast food so dangerous, is seed oils. It's not anything else, in my view. Sure, drinking soda pop with sugar is a problem, but the primary problem is the seed oils because everything's cooked in those. So you have to primarily prepare your own food, get these out of your diet, and your omega-6 in your own body will gradually go down over 3 years, down to ancestral levels, and you'll start getting healthy within hours and days. 3 years. It takes to get them out of your diet completely. So if you stop completely and you bring your omega-6 consumption down to an ancestral level, which means it's under about 2% of your total calories, your omega-6 linoleic acid, in 3 years, you will be down to an ancestral level of omega-6 in your body. And that will gradually, like quitting smoking, you'll gradually get healthier. And 3 years later, you're going to have almost eliminate your chances of coronary heart disease, cancer. Diabetes just reverses. Metabolic syndrome reverses just by doing this. And I have people email me all the time telling me how they have lost so much weight, they reversed their diabetes, they reversed their metabolic syndrome, their macular degeneration has stabilized, these kinds of things.
Typically here, I ask about significant compliments and significant complaints as a result of your work. Let's talk about the complaints. What's one big complaint that you hear?
I've been in the public eye doing this for 8 years now, since 2016. I've never had a single complaint except from one journalist who is a sugar theorist who said to me via email, "You haven't considered all the evidence against sugar," essentially.
Right.
But I have people don't complain that it's hard to do so much. I think it's fairly simple to reduce or even eliminate your seed oils, but you need to be extremely vigilant about that. And you need to mostly prepare your own food.
Yeah.
Best thing to do.
Yeah. My wife and I, since I started hosting Phil Ovadia's show 3 years ago, have gotten really serious about it. And every now and then, we just feel like not cooking for ourselves.
Yeah, me
We
too.
want to go out and get something.
Absolutely.
And more often than not, we just say, you know what? It's just not worth it. And in fact, the last time we went out to eat was just this last week, a place that serves chicken wings that we both love. But I think we've been doing it long enough that our bodies are becoming more sensitive to the introduction of stuff that isn't good for them. We both agreed the chicken wings were every bit as delicious as we remembered, and we both felt crappy after having eaten them. And we're not going back. It's kind of sad, but
Yeah.
we'd rather be healthy. Okay, this is my favorite question in the whole show. If you could deliver just one message about health and you had no more than 8 words, what would that message be?
You prepped me for this question, and the answer is seed oil free is key to disease free. Now, our mantra is usually seed oil free is the key to being disease free. That's the mantra we use. I've, mentioned this in many podcasts or many presentations, and so we have basically a slide on that. But anyway, you can shorten it to seed oil free is key to disease free. That's it.
Seed oil free is key to disease free.
Yes.
This one's powerful. This is really good. And I will attest that when you begin looking at everything that has seed oil in it, it can be a little bit discouraging because there's lots of things that I used to like to eat. I don't eat anymore.
Yeah.
And I will also say, it gets easier and easier with time, and it becomes easier to tell when I've eaten something that my body really doesn't want.
Right.
So, folks,
I tell people, Jack, to just use butter for everything. That's what we do. We just use butter for all cooking. If you need lots of oil, you can use coconut oil. And if you don't like the flavor, you could even use refined coconut oil, because that just basically they steam it and it removes the flavor of the coconut. So those are the really healthy options.
We use butter, coconut oil, and lard.
Mm-hmm.
I'm a big bacon fan. So
if you use lard, you need to make sure you get it from farmers, ranchers that raise their pigs on ancestral diets. If they're fed corn and soy, the omega-6 in their body fat will go very high, just like all other monogastric animals, including humans.
I'm glad to hear
that's
you address that.
yeah, that you have to be careful about that. That's all in my book. The newest book is called The Ancestral Diet Revolution. I've got a copy right here if you don't mind me
Not
showing.
at all. That's
Yes.
part of why we're here.
Yeah,
The
The Ancestral
Ancestral
Diet
Diet
Revolution.
Revolution. And I
And
believe that's the name of the website too, isn't it? Oh,
well,
ancestralhealthfoundation.org.
yes, that's it.
All right, very good. We'll make all these links available in the show notes. Dr. Chris Knobbe, thank you so much for being with us, and I look forward to hearing more from you.
Thank you, Jack. I appreciate it. It's been an honor. Thank
We'll
you.
talk to y'all later.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.